Hepatitis. Most common medical myths. Hepatitis refers to inflammation of the liver. Most commonly, it develops due to a viral infection or alcohol consumption, but it can also result from toxins, drugs, and certain conditions, including autoimmune conditions. There are 5 main types of hepatitis: A, B, C, D, and E. Hepatitis B and C are the most common. In this video, we address and dispel some medical myths that are commonly associated with hepatitis. All types of hepatitis are equally serious. Some types of hepatitis are self-limiting, which means that they clear up on their own. Others can cause liver cancer or permanent liver damage. The hepatitis viruses are actually very different. Hepatitis A often makes people feel very sick for a short time, but it is very rare to have any kind of serious complications or long-lasting illness. Hepatitis B can be very serious if a person's initial viral infection becomes a chronic infection, but that happens in only 2 to 6% of adults, and some people never have symptoms during their initial infection, though the majority do. Hepatitis C often doesn't cause symptoms at first, but around 60 to 80% of people with a hepatitis C infection go on to develop a chronic infection, which eventually can lead to liver cancer, liver cirrhosis, and death if left untreated. This is why it's important to be vaccinated for hepatitis A and B and screened for hepatitis C at least once, even if you feel well. Hepatitis C is rare. According to the World Health Organization, 325 million people have hepatitis B, C, or both. The Centers for Disease Control and Prevention say that in the United States in 2019, there were 1,15,900 acute hepatitis A, B, or C infections. In 2016, the World Health Organization estimated that 3,99,000 people died from hepatitis C globally. Together, hepatitis B and C are the most common causes of chronic and liver cancer. They also cause the most viral hepatitis-related deaths. An estimated 71 million people worldwide and 2.4 million people in the United States are living with hepatitis C, which is double the number of people in the United States living with HIV, even though hepatitis C is totally curable. People with hepatitis C cannot breastfeed. Hepatitis C virus does not spread through breast milk. However, with cracked or bleeding nipples should temporarily stop breastfeeding until there has been healing. People can contract hepatitis by kissing and holding hands. Although this myth is widespread, it is still a myth. People cannot contract hepatitis C virus by kissing, holding hands, sharing eating utensils, mosquitoes, coughing, or sneezing. Hepatitis C virus spreads when someone comes into contact with blood from someone who has contracted the virus through shared drug injection equipment, non-sterile tattoo equipment, birth, or rarely sex. People cannot have sex if they have hepatitis C. It certainly is not true that people with hepatitis C cannot have sex. However, there are some things to consider. Hepatitis C virus spreads through contact with blood from someone who has contracted the virus. Sexual activities that increase the risk for exposure to blood, anal sex and sex during menstruation are high risk. For monogamous couples, the Centers for Disease Control and Prevention does not recommend routine condom use to prevent transmission. The risk of transmission is higher in those with HIV and in those with multiple short-term sexual relationships with partners who have hepatitis C virus. Under these conditions, condoms should be routinely used. All people with hepatitis have jaundice. Jaundice is a sign of liver problems, but not all hepatitis viruses cause liver problems right away. About half of people living with hepatitis C have no symptoms at all until sometimes decades down the line, when the virus has damaged their liver severely enough for jaundice or other symptoms to appear. Hepatitis is genetic. There is a myth that hepatitis C is genetic and therefore can pass from generation to generation. This is not true. Hepatitis C is a virus. It is not genetic or inherited from parents. In rare circumstances, hepatitis can transmit from the mother to the child during childbirth. However, the chance of this occurring is around 2 to 8%. There is a vaccine for all types of hepatitis. This is not true. Currently, there are vaccines for hepatitis A and B. Both of these require multiple shots to complete the series. As it stands, there is no vaccine for hepatitis C. Hepatitis C cannot survive outside of the human body. In 2014, researchers at Yale University found that hepatitis C remained alive a full 6 weeks after drying on a surface and had enough infectivity to infect someone. Previously, people thought it could only live 4 days outside the body. Unfortunately, it's a very hardy virus. Hepatitis C cannot survive outside of the human body. In 2014, researchers at Yale University found that hepatitis C remained alive a full 6 weeks after drying on a surface and had enough infectivity to infect someone. Previously, people thought it could only live 4 days outside the body. Unfortunately, it's a very hardy virus. People cannot contract hepatitis C twice. This is also a myth. Once someone is treated and cured of hepatitis C, they can contract it again. Antibodies from the original infection don't protect you like a vaccine might if we had one. Having hepatitis C virus once does not provide immunity against getting the virus again. People can contract it again after clearing the virus naturally or after being treated with medications. This is why it remains important to take precautions against reinfection once someone's initial infection has cleared up. Hepatitis C medications have bad side effects. This is not true. Current treatments for hepatitis C virus usually involve 8 to 12 weeks of oral therapy with pills. Cure rates are now over 90%. These new medications have very few side effects and are very well tolerated.